I want us to watch this documentary, Drugs of Doom.
Pharmaceuticals has turned the U.S. into a nation of pill poppers.
I had never experienced the kind of euphoria that I got from a pain pill.
First he said that I had ADD. Then he said that I was depressed. Then he said I might be bipolar, but I don't have ADD anymore.
What they decided is that both my husband and my son had a chemical imbalance that needed to be corrected with a chemical balancer.
There is not one shred of credible evidence that any respectable scientist would consider valid, demonstrating that anything that psychiatrists call mental illness are brain diseases or biochemical imbalances. It's all fraud.
Drug side effects are so toxic that people are dying by the minute. The Parliament of Canada website states, all drugs cause adverse reactions, not some, all, and many are deadly. The president and founder of Eli Lilly once said, any drug without toxic side effects is not a drug at all. Rare means between 1 out of 1,000 and 1 out of 10,000, so take no comfort with rare side effects.
They are facing a time in which drugs from big pharma cannot be trusted anymore.
What's your...
History is replete with a plethora of evidences that clearly expose how the pharmaceutical industry, which many so blindly trust, have weaponized medications originally intended to cure illnesses, with resultant side effects that have injured and maimed many for selfish gain.
We're seeing so much in the medical field today that's bringing to question the sincerity of the pharmaceutical industry. Now we realize it's mostly been about money. It's very sad, very painful. We realize that they were never there to make you well. Well, why would you be surprised? They needed to compete with the counterparts in other industries. They needed to make money too. So they would be broke if you were well. So what they're gonna do? Make you sick. So they give you drugs to help you on the one hand and to give you some sickness on the other hand.
Women who take Lipitor or the other statin drugs for cholesterol have approaching a 50% greater chance of developing diabetes, according to this study.
Because the pharmaceutical industry isn't in the business of health and healing. It's in the business of disease management and symptoms maintenance.
My name is Peter Gøtzsche. I'm a director of the Nordic Cochrane Center in Copenhagen and professor of research design and analysis at the University of Copenhagen. 2 years ago, I found out that our prescription drugs are the third leading cause of death after heart disease and cancer. Our drugs kill around 200,000 people in America every year. And half of these people die while they do what their doctors told them. So they die because of the side effects. The other half die because of errors. And it's often the doctors that make the errors, because any drug may come with 20, 30 or 40 warnings, contraindications, precautions and so on. No doctor in the world knows about all this. So they give patients drugs that they should not have given them, that interact dangerously with other drugs or food items or so on. And then the patients die. That's the other half. So the other thing I found out 2 years ago was that much of what the drug industry does fulfills the criteria for organized crime in US law. And they behave in many ways like the mafia does. They corrupt everyone they can corrupt. They have bought every type of person, even including ministers of health in some countries.
On this altar of greed and corruption, the health and lives of many have been gruesomely sacrificed. As several unsuspecting individuals, who turned to medical practitioners for solutions, wound up in even worse conditions than they were before medical intervention.
Do you know, many people after taking the drugs, they get in a worse condition that eventually takes them to the hospital. And sometimes in the hospital, they're given drugs that get them into a worse condition.
When Jimmy Corrigan left on deployment in the Navy 3 years ago, he was in the best physical shape of his life. Today, he can't walk without a cane. He gets angry for no reason and has been hospitalized twice to prevent suicide.
Keep your stand up straight.
2 military doctors say Corrigan suffered a brain injury after taking the anti-malaria drug mefloquine. Corrigan, who was never in combat, says his very first dose caused hallucinations and depression.
Something wasn't right, like a doomed kind of sensation, like something's different.
Corrigan's wife, Nikki, says mefloquine destroyed Jimmy's balance and changed his personality.
The best way I can describe someone on mefloquine is literally as if someone had taken my husband's brain and put somebody else's in there.
Any questions or comments from the committee? This time we'd like to call David Cope.
My name is Lieutenant Commander David Cope of the United States Navy. I'm a 2007 graduate of the Naval Academy at Annapolis and a 2012 graduate of MIT with dual master's degrees in mechanical engineering and naval architecture. At 32, I'm a disabled veteran, soon to be medically retired from the Navy due to chronic health conditions resulting from the use of the benzodiazepine Ativan as prescribed over several years. The indisputable reality of short-term usefulness and long-term risk demands patients receive explicit, informed consent prior to benzodiazepine prescription. I cannot roll back the clock. I will not regain my career as a naval officer.
Avoid having to go for drugs as much as possible.
While all drugs have been proven to have side effects, and sometimes adversely debilitating side effects, the psychiatric industry stands as an arm of medicine that has been weaponized with psychotic drugs as bullets for the sickening and damaging of the healthy.
Mental health, for example. Mental health. Because a lot of people were trying to cast out demons from, cast out devil. Some of those people don't have any devil. The devil is the drug. They're on certain drugs. See, they complained they had some problems, and then they gave them drugs.
I was a waitress in New York City. Pretty normal girl doing normal things, nothing exceptional, nothing not exceptional, just normal. My mind was clear, I was happy. The only little issue I had was I couldn't sleep. So I went to my doctor, just my regular doctor. I'd see him maybe twice a year. And I asked him for something for sleep. And he would always say to me, I'll never forget. He always hit me on my knee. Just go to sleep. You're too young to not be able to sleep. Just go to sleep. I don't write prescriptions for sleeping pills. If you want that, you have to get it from a psychiatrist. I then said, yeah, sure, why not? He gave me a referral, and I took the referral and I called a bunch of psychiatrists, and this one doctor in Brooklyn said, yeah, we're seeing patients, come on in. He gave me a prescription for lorazepam. He told me to take 2 in the day and 2 at night. I then said, why would I need to take a sleeping pill during the day? I don't want to sleep during the day. And he said that is how it works. I said, okay.
You know, when they come to see a doctor, they want that pill that they hope will take care of their problem thoroughly and rapidly. And most of these medications will actually do that very well in the short term. So that's the other thing that's so hard about it. In the short term, they really work. The reason that I kind of changed the way I practiced was the realization that I was actually harming my patients.
Just in case you're wondering what lorazepam is, according to the WebMD website, this medication is used to treat anxiety. Lorazepam belongs to a class of drugs known as benzodiazepines, which act on the brain and nerves, central nervous system, to produce a calming effect. However, there are serious side effects, including mental or mood changes, such as hallucinations, depression, thoughts of suicide, trouble speaking, vision changes, unusual weakness, trouble walking, memory problems.
I didn't even know people could have sleep issues because I was sleeping normal all my life, so it's not something I thought about. But I had a feeling it was my job. I just didn't think I could quit my job. I thought I could get help for it. That's how come I went to a psychiatrist. And he prescribed me this drug, lorazepam. I took it for 6 years. And
You took lorazepam for 6 years?
6.5 years. I had brain zap. I had tremors. I had severe night sweats. I have a symptom where it feels like things are crawling inside my body, just moving. And I came across this image and I was like, wow, that's exactly how it is. I found this image also. This picture says exactly how it feels inside my head when I say I have these burning sensations that are just all over my spine and my body. The image is so truthful because I don't feel anything here. Right here is very normal. It's just here, just everything here. That's exactly how it is.
On another hand, many others who take the psychotropic drugs for the prevention of other ailments become subjected to the woes of badly deteriorating health conditions. Worse still, addiction and dependency set in upon use of such prescription drugs. Ironically, the psychiatrists outrightly deny the consequence of addiction as a result of these psychiatric drugs.
But listen to what some psychiatrists questioned at a recent APA conference had to say about addiction.
How addictive are psychiatric drugs?
They aren't. Only benzodiazepines.
They're not addictive at all. Antidepressants are not generally considered addictive.
SSRIs are not addictive.
Antipsychotics, they don't cause addiction.
Major tranquilizers are all safe as far as addiction is concerned.
The drugs that most of us are using in neuropsychiatry are not addictive at all.
But on the contrary, the victims of addiction and dependence resulting from the use of psychiatric and psychotropic drugs reveal a differing angle of the story.
The psychologists and psychiatrists, I went to both. They never told me that they would be addictive. They would cause me to have these thoughts. For sure, the psychiatric drugs I was on was addicting.
Within six months to 9 months, I was hooked.
Xanax had a hold of me. I mean, I was going through a bottle of pills every 3 or 4 days.
I lost my job over it. Over a prescription drug that's not supposed to be addictive. Lost my job.
The reality is that it is addicting. It will wreck a person's life.
Every single one of these drugs are addictive, psychologically and or physically addictive.
They change your body's makeup. You change your body how it reacts to things. And so even though people, their psychological state, they may be over their depression, they physically will need that drug still. And so that becomes the complication of getting them off.
I have people come to me on a weekend, they run out of refills, and they say to me, if I don't take this drug, I'm going to get sick.
According to the 2019 British Parliamentary Inquiry, 1 in 5 Americans take prescribed psychiatric drugs every day. While these drugs help some people in the short term, there is growing evidence that long-term use leads to worse outcomes.
I was reading certain drugs that they were prescribing in the hospital to help people control mental problems. They said that those people may have mental problems. Now, how did the diagnosis go? They sent these officials to the schools to check on the kids, test them. Now these kids, there was no complaint. Said this one is hyperactive, always raising the hand for questions. He was penned down for hyperactivity. So all the ones that they penned down were recommended for certain drugs, and then they put them on these drugs, and these children were never the same again. The drugs caused mental problems.
Some common labels now mistaken for mental problems in children are ADD and ADHD. ADD refers to attention deficit disorder, while ADHD refers to attention deficit/hyperactivity disorder, a complete misconstrual and over-exaggeration of simple behavioral traits of little children and young people who are simply energetic, and the psychiatric medications for these manufactured conditions have wrought more harm than good, to the health of these young children.
Line breaking at this hour, and it involves millions of American families, the 6 million children who suffer from ADHD, a first-of-its-kind study out of the CDC about small children, preschoolers, as young as 4 and 5 years old.
It's very concerning. What they found is that a quarter of children who are in preschool with attention deficit disorder are only getting drugs.
So what is the concern, though, about the medications?
Well, they can have serious side effects, especially in very young children, problems with sleep, with appetite and behavior. It's very troubling.
A new study reveals some ADHD medications may cause an increased risk of psychosis. It says that teens and young adults who take amphetamines like Adderall are twice as likely to develop the condition.
Something we don't talk about. We think ADD medications are very safe when the research says that 100% of the time, your child will have a side effect. 100%. And that list of side effects can be what's perceived as mild, right? So the top 3 side effects are irritability, sleep problems, and restricted eating, right? So if you're not sleeping and you're not eating, what's going to happen to your brain? Your brain is not going to be working like a Ferrari. It's going to be working like a 1992 Hyundai. The long-term research says you're going to have one of these side effects. There are many others, including psychosis, which nobody always wants to, they all want to say it's rare. I mean, how come I've seen dozens of kids with psychosis from psychostimulants? It happens. We just aren't talking about it. So, has side effects 100% of the time. Some of them are perceived as mild, and some of them could be as severe as psychosis and cardiac problems and seizure and other things.
While medications for ADD and ADHD have proven to worsen the health condition of young children, another drug that has garnered a fear-inducing frenzy so great are statin drugs. Largely acclaimed for their anti-cholesterol benefits to help protect users from heart attacks. On the contrary, cholesterol is a pivotal requirement for the body's biological functions, and taking anti-cholesterol medications could only result in dastardly health side effects.
Millions of people have been prescribed a class of drugs called statins. These drugs are supposed to lower cholesterol and thereby prevent heart attacks. Well, first of all, do they lower cholesterol? And the answer is yeah, they lower cholesterol. But here's a very important question. Do they prevent heart attacks? No, they don't. Are they safe? No, they aren't. So if you're taking a statin, you're taking a drug to prevent heart attacks that does not prevent heart attacks. And further, you're taking a drug that is not safe and does you harm.
They push those drugs to these doctors for sales. They want to get as many people on these particular medications as possible. An example of that is how they've done with the with cholesterol. How used to a healthy cholesterol was one level, and it was, as long as you were that level, it was perfectly fine. Well, they kept lowering the standard, but lowering the, oh, well, if your cholesterol is that, then, oh, you need a statin.
We've been convinced by about 35, 36 years of pharmaceutical profiteering that cholesterol is the Antichrist and that statin drugs are a savior when, quite frankly, just the reverse is true. Low cholesterol levels are associated with an increased chance of death, an increased chance of cancer, high percentage of birth defects, peripheral neuropathy, short temper and aggressive behavior, kidney failure, and dementia.
In the light of these shocking revelations about the horrendous life-threatening side effects of drugs, it matters that God's people pay heed to God's counsel on their health in these last days, more than ever.
Don't live your life on drugs. Okay? Health has been given to you by God. Trust God for your life now. If there was ever a time for you to trust God, it is now.
My child, pay attention to what I say. Listen carefully to my words, don't lose sight of them. Let them penetrate deep into your heart, for they bring life to those who find them, and healing to their whole body. Proverbs 4 verses 20 to 22.
Praise God.